The MEGADYNE MegaSoft reusable patient return electrode is designed to enhance patient protection in monopolar electrosurgery. Traditionally, an adhesive return electrode, such as a sticky pad placed directly on the skin, enables current to flow during the procedure. It completes the surgical circuit from the generator through the monopolar blade and patient, through the adhesive patient return electrode, and back to the generator. Current flowing from the patient to the small surface area of the adhesive patient return electrode allows high current concentration to build up at the pad site, which can introduce risk of patient injury. A reduction in surface area at the pad site or pad contact with a conductive material can increase current density at those sites, resulting in patient burns. In contrast, the MegaSoft patient return electrode is a capacitive return electrode, which completes the circuit necessary for surgery. Both the conductive mesh in MegaSoft return electrode and the patient conduct current. An insulation material around the conductive mesh in the MegaSoft return electrode pad separates the conductive mesh and the patient, forming a capacitor. When energy is applied, electrons do not flow directly between the patient and the conductive mesh due to the layer of insulation. Instead, the energy in the conductive mesh and the patient interact through an electromagnetic field. Since the generator provides an alternating current, the accumulated charge switches rapidly between the patient and the conductive mesh. Current flowing from the patient to the large surface area of the MegaSoft prevents high current concentration buildup at the pad site. Compared to an adhesive return electrode, there is virtually no risk of pad site burns, no matter how the patient is positioned. As the contact area between the patient and the return pad decreases, the charges in the patient and return pad are reduced, resulting in a decreased capacitance while maintaining a constant temperature. Since there is no direct conductive contact with the patient, tattoos, metal implants, and other conductive materials will not create an area of high current density, reducing the risk of patient injury. MEGADYNE MegaSoft reusable patient return electrodes, designed to enhance patient protection.